Are we expecting more participants? Okay, I think we should get started.
Okay.
Welcome to the inaugural PUBGEM-Africa Science and Society Café on Genomics, Data Science and Health Research. I'm Jill Black, and I will be the moderator for today's webinar. And my thanks to Nchangwe for inviting me to be here today. PUBGEM-Africa, which stands for Public Understanding of Big Data in Genomics, Medicine in Africa, is a bioethics project within the Data Science for Health Discovery and Innovation in Africa, or the DSI Africa Consortium. PUBGEM-Africa is housed at the Division of Human Genetics at the University of Cape Town in South Africa and has research sites at the University of Ghana and the University of Yaoundé in Cameroon. PUBGEM-Africa is funded by the US National Institutes of Health, or the NIH, and we specifically acknowledge the support of the National Human Genome Research Institute and the National Institute of Mental Health. We are very delighted to have you all here, and thank you for making the time to come to this Science and Society Café. The PUBGEM-Africa Cafés are guided by the African philosophy of Harambee, and Harambee is a Swahili word for "let us work together for the common good." These cafes are therefore an opportunity for everyone, irrespective of their expertise in a particular subject or discipline, to engage in conversations about the societal, cultural, legal, and ethical considerations for the biomedical sciences, particularly genetics and data science in medicine and research. At today's PUBGEM-Africa Café, we will discuss innovative approaches used by researchers to engage diverse communities in genomics and data science research in Africa, and in building and sustaining trust between researchers, research institutions, and the public. The goal is to have a conversation on community engagement strategies that may be effective and acceptable for genomics and data science for health and innovation in Africa. So during the cafe, we encourage you to use the Q&A box to share your views or experiences on community and public engagement for genomics and data science in medicine and health research. We will also be giving some time, as much time as we can, for oral contributions from attendees. So each speaker is going to offer a 10-minute presentation, and that will be followed by 5 minutes of Q&A time per speaker. And then after the Q&A session for our last speaker, we will have our intervener, Andrew Nantogma, to give a brief commentary on the collective presentations. So our first speaker today, who has joined us at very short notice, so thank you very much, is Khaira Boteng. And Khaira is the Community and Public Engagement Officer for the West African Centre for Cell Biology of Infectious Pathogens at the University of Ghana. She holds a Bachelor of Arts degree in Political Science and English from the University of Ghana and a Master of Arts degree in Community Development. She has years of experience in the design, implementation, management, and knowledge translation of public health interventions, especially using culturally appropriate communication in low-income settings. She contributes to participatory and inclusionary community engagement activities and creates avenues for interactions between scientists, hard-to-reach communities, at-risk groups, and relevant stakeholders. Khaira is a 2-time winner of Falling Walls Engage, an initiative of the Germany-based Falling Walls Foundation, which celebrates science engagement activities globally. So thank you very much, and over to you, Khaira.
Okay, hi everyone. Yes, thanks for joining. I'm happy to be present this afternoon. So As you already heard, I'm Chua Boateng, and I have some few slides to share here. Is it possible to share the slides here? I don't know if
sure one of our co-hosts will be able to help you with that.
Yes, please. I haven't challenged. I actually shared it with the co-host, so if it can be screened here for everyone to see.
Okay. Is there a co-host out there who can help us?
Yes, I have enabled you as a co-host. You can share your screen, Kaiwa.
Okay, so great. I'm trying to actually share it from my side here. So I'll just try to, whilst it's being shared, I'm trying to just insert it on this on the laptop. But whilst this is being shared, I would want to just share a brief. So at WACBIP, we do have a whole lot of activities that target community and public engagement activities. So WACBIP is the West African Center for Cell Biology of Infectious Pathogens. And yeah, so we do have a lot of community and engagement activities so that targets hard to reach and minority groups. And with the research that we are involved in, we make sure that we break it down for public understanding, for them to also contribute and also give feedback on the activities or the research that we do. So one of the activities that we engage in is the use of docudrama to engage persons who are deaf. And it is one of the initiatives which is very new and is very engaging, especially for the communities that we do engage in. This is quite novel. Great. Yes. Thank you very much. Thank you very much. Yeah, so going through the slides that I have presented, I'll just take you through why we actually created and then the processes that was involved in the creation of the docudrama. So docudrama is actually a combination of documentary and drama. And this was co-created with different kinds of communities that we engage in, especially deaf communities that we have in Ghana here. So the need for this docudrama came about with the need for our researchers to explain into simpler forms the meaning of genetics and also to break down into simpler languages, how we can actually explain terms like genes, cells, genetics, DNA to persons who are deaf. And we know how it is quite challenging when engaging persons who are deaf in our parts of the continent. So we also got to know that there aren't a lot of community and public engagement activities that are centered on deaf persons, trying to get their perspectives and also engaging them. And we also found out that there are a whole lot of African traditional beliefs that we've attached to being deaf, and also the kind of cultural beliefs that is engaged in genetic studies and a whole lot. Is the next slide. Okay, so this actually summarizes some of the challenges that as scientists here at WACBIP face during engaging such minority groups. So we do, as I said initially, we do a whole lot of community engagement activities with most of our researchers engaging in the genetics part of hearing impairment. So this actually summarizes the reason why we came up with the usage of the docudrama. Is the next slide. Yes. So in the creation of the docudrama, we actually engaged different types of stakeholders that came together to co-create the science communication toolkit. And it is called A Smile of Hope. It is actually 25 minutes long. So we have two versions, one for deaf persons and then one for hearing persons. So in coming together to create this masterpiece, we engaged the different stakeholders, which were from the Ghana National Association for the Deaf. And as you can see in the picture, that is one of their representatives who is doing the sign language interpretation for one of the workshops that actually brought together the scripts that we got a lot of ideas from this workshop in writing the script, how the characters will be in the docudrama, and how the whole docudrama should be done. Yes, so the workshop brought together different stakeholders, and then the focus, what should the duration of the docudrama be, and also the language and the terms that will actually explain the scientific terms, make it easier for our hearing impaired communities to understand. The next slide. So yeah, so these are some of the main themes that came out from the workshop that brought together the different stakeholders. We saw that there was a need for effective communication and also the need to dramatize the docudrama and make it culturally acceptable, and that can be easily identified with the communities or the prioritized groups that we are targeting. The next slide. Good. So finally, the docudrama was made. The processes of making the docudrama was an interesting one. It was a learning experience for most of our researchers who actually participated in the creation of the docudrama and in the communities that came together to make this whole docudrama. So we had some of the cultural displays that were depicted in the drama, going on sites and sharing ideas with the persons who are deaf, engaging traditional leaders, and also getting to know their perspective in bringing out this whole idea, making it come into realization. So the docudrama, as I said, is 25 minutes, two of it, one for the hearing impaired persons and one for hearing persons. The next slide. Good. So after the creation of the docudrama, we needed to actually test it and see if there were supposed to be any changes from the drama that has been made. So we did piloting of the docudrama in different types in different regions of the country. And after the piloting, we got to know that there was the need to actually translate the docudrama into different types of Ghanaian languages. And so it was translated, and there were voiceovers that actually targeted the different parts of the country in Ghana. And probably with the Ghanaian participants here, we had Akan, Ga, Ewe, and then also some targeting the northern region of Ghana, which is Dagbani and Guruni. So these actually refine the docudrama, making it very adaptable and also easy to use in the communities that we were targeting. The slide. Okay. So please go to the next slide. So in actually implementing the docudrama, we made sure that we train our research scientists, because the docudrama is actually made for our research scientists to actually use it as a community entry toolkit to engage the communities that they will be going in, either for sample collection, either for other community engagement activities. So this drama was created actually for our researchers here at Wagner to use it as a community entry toolkit. And I mean, before they go on, they needed to be trained. So they were trained on using the toolkits, on using it as a community entry toolkit, and some of the things that they needed to know or understand in engaging their prioritized communities, which is a deaf person. So far, we have actually impacted a lot in implementing this research actually with using the docudrama. We've engaged over 1,000 deaf persons, including their communities and then their families in about 5 regions of Ghana, which is the Northern Ghana, Eastern Ghana, Western Ghana, Greater Accra, and the Upper East regions of Ghana. So this research actually has taught us a whole lot of lessons. As I said initially, it's quite novel, and we have been able, with the few lessons that has been learned from creating this toolkit as a science communication toolkit, we've learned that science communication should be built on clear and concise languages. There should be community feedback from the people that we engage with. So after the docudrama was made, we tried to actually get a perspective of the communities that we engage with. And with this toolkit, we know sure. We've actually understood the communities that we engage in better. There's been genetic research sensitization, better engagement with deaf persons, their families and communities. And we are also able to break into the superstitions and myths that actually comes with deafness, and probably trying to get samples from the communities that we engage with. And we've also gotten to, so we believe that scientists and communities have stories to share, and most of the stories that shared has been packed into the docudrama, which brings about full understanding. And we believe that a lot of lessons have been shared with the usage of this docudrama. So that is it. We are still, the docudrama is available, and hopefully we'll share it on the link so that you can actually watch it and relate with it. So thank you very much. This is a little presentation that I had on the docudrama. Hopefully later on questions about it will be answered in the later presentations. Thank you.
Thank you very much, Kaiwa. That was a fascinating presentation. I'm not seeing any open questions in the chat, so we'll give people a couple of minutes to put their questions in there if they have any. But perhaps I could just ask you, so this is very challenging work that you're doing, very admirable work that you're doing. I'm very interested to know, what would you say were the main challenges in developing the docudrama that were particularly relevant to engaging with deaf persons? What would you say that the biggest challenges were, and your biggest points of learning that you might want to communicate to others in this field who are interested to follow the same approach?
Yeah, so thank you very much for the question. So as I said initially, this was quite a novel initiative. I mean, getting scientists on board to actually co-create these with the communities that were involved. It's that was exciting, but then the challenging part was bringing these groups of people together, working with deaf persons, having to learn the sign language, which has actually taught me some few sign languages to use, and the importance of using the sign language. It was quite. Oh, okay. So let me actually switch on my cameras. Good. Sorry. Yeah. So one thing that I would want to say is that because the docudrama is actually a video, okay, so we will have to, in actually sharing it, we'd have to probably go on our website to actually view it, or we would have to actually show it to you. I think that is the main challenge of being able to experience the docudrama itself. So I think these two challenges of engaging the different stakeholders, especially deaf persons, was something new for us. And also the use of the toolkit itself, because it is actually a video. Hopefully in the future, we can actually look at different types of communication tokens, which would be easier to spread or easier to actually watch. So I think these are the just.
Thank you. Thank you very much for your comprehensive answer and a really brilliant presentation. In the name of time, I'm going to move us along to our next speaker. So our next speaker is Dr. Setlomo Kolwai-Kikatsi, a senior lecturer in the Department of Educational Foundations at the University of Botswana. Dr. Kolwai-Kikatsi has a PhD in educational psychology and teaches courses in educational research and evaluation and applied statistics. She's completed a postdoctorate in bioethics from Johns Hopkins University in the USA and has published extensively in national, regional, and international peer-reviewed journals. Dr. Kolwai-Kikatsi is a member of multiple national and international research-related associations and serves various committees at the University of Botswana. She's also a board member for the Botswana Labour Market Observatory governing body. Over the years, she has developed a strong interest in how researchers can engage with local communities, members of the public, and other stakeholders to understand their perspectives on issues relating to the value of research, governance, policy, and regulations in Botswana. Her presentation will focus on community consultation for genomics research in Botswana. Thank you, and over to you, Dr. Kolwai-Kikatsi.
Good afternoon. Presenters that I missed, I just joined because I was having a technical problem. As already introduced, my work is really focused on looking at it, trying to find ways of engaging, innovative ways of engaging with communities, particularly talking about issues of talking about scientific concept. Like my project was entirely on genomic editing. I wish I could have the technicians share my slides, that side, if it's possible, or else I could continue with my slides. But as they're still sharing, I can continue with the project aim or project goal. The idea at the beginning was just to empower local communities about the human cell structure, and also empower them about the genome itself and the use of genomic editing technologies for health interventions. Also, as the goal was to try to find ways of bringing awareness, and as we engage, we bring awareness to the communities about some potential benefits and risks that might come with the use of gene editing technologies that are upcoming globally to be used to intervene, particularly hereditary related or genomic related diseases. Part of the document of the project was also just to highlight some of the community values, community belief systems, the norms, and that might have an impact on the on future participation of communities in genomic research, particularly with the use of gene editing if it comes to Botswana at any point in time. So I don't know whether they are sharing that side. Because of time, I will just continue. The engagement process started off with the debriefing of village headmen. In Botswana, we are known to still be holding very fast, very tight to our chieftainship, to our chiefs, to our local chiefs, because they are seen to be very, very important in terms of community, as community gatekeepers. Whatever you want to do in the community, you have to go through the chiefs or the headmen. In Botswana, we have what we call paramount chiefs. The paramount chief will be the big, like a president of a particular tribe. And underneath the paramount chief will be headmen or sub-chiefs, right? And then the process of engagement was actually taking place in a kgotla. In Botswana, I don't know, a lot of African countries, I think, they will agree that in Africa, indigenous people, our indigenous parents will continue to gather together in one place to discuss issues, just like we are doing with modern world, where people are gathered in parliaments or house of chiefs or house of wherever they are gathered. But in Botswana, we use what we call kgotla. Kgotlas are open village courts. These are where we had our meetings to engage with our local communities. And as we do that, we didn't just do that. The engagement, like it was still culturally based, because we want to promote our cultural values, our cultural norms, our cultural practices. So chiefs and headmen were involved throughout the process. From village to village, debriefing was conducted with the chief or the headman to engage with them so that before we can engage with communities. The kgotla meeting, during the kgotla meetings, the first thing that we did after the chief or the headman, mostly were the headmen of villages, when they say, okay, we can come and engage with our people, we had to gather at the kgotla as usual, and we had to do like a ceremony, not a ceremony per se, like an opening ceremony where the chief or the headman would, let me just keep on saying headmen, because the chiefs were not really involved, mostly were the headmen of villages. Chiefs are like bigger at the higher courts. So the headmen were there to brief the community or members of the community that participated about the purpose of the meeting, which is that's a way of communication, a way of engagement. Normally people need to be informed. What is the purpose of these visitors that we have today from University of Botswana? Why are they here? What are they going to tell us? Listen attentively, and then the chief will say, welcome, so that he will welcome. Then what followed was us, the research team, introducing ourselves, introducing the project in our native language. Throughout the process, everything was done in our native language. Okay, and then the engagement method. Now we just go back, not to, because this was like a where we are using both the cultural practices of going through the posse and making sure that you are using the kgotla, like the place where we want to share with communities, to engage with communities, to empower our communities. We used we borrowed a Eurocentric kind of method, the qualitative deliberative framework from Rothwell, and then use the case study just to ensure that everything that we are getting an in-depth understanding of what people think about the use of genome editing for medical intervention. A total of 109 people throughout, because we visited about 7 ethnic communities around the country, like going around the clock. We only managed to visit 7 ethnic communities. And out of the 7 ethnic communities, because of our financial constraints, we wanted to cover as much, but because of financial constraints, we could not cover everyone. So a total of 109 participants were community members participated, and we wanted to engage in a manner that we tried to balance to ensure that we do not leave anyone behind. We engaged with village elders through that engagement. Village elders were people who are like, we see that these are the people that carry the values, that may have a lot of understanding about heredity as it was. And then we also engaged during the time, it was like focus group of headmen, of village elders, headmen in one setting, traditional healers. Why? Because we were talking about issues of heredity, and it's a medicinal, how it's been used in our culture for medicinal purposes. And also we engaged because we religious leaders and young persons. And we were trying to get through Snowball, where we were telling the headmen ahead of time, please, if you can bring to the quota this kind of people so that everyone is represented. I hear Professor Sindana that we're really engaging people with some level of disability who cannot, but ours did not. And it's like something that we can talk about later. And then what we used during the educational materials, community educational materials. I don't know whether the team can be able to share a little bit. We use local language-based video presentations, local language video presentations. I don't know whether my slides are being shared. May I? Are they being shared? Are you able to see my slides so that?
Yes, we can see your slides. Well, we were able to see them one moment ago.
Okay, thank you.
They're not there right now.
I don't know whether if the technicians will allow me to, or in the interest of time. This is a video. I don't know whether we can just play it for 2 minutes. I was trying to be fast so that we can play it for 2 seconds, if it's possible. Just for people to appreciate what we did in this
Maybe
project.
just for
Thank you very much.
perhaps just for 1 minute, we could get a sense.
Yes.
Okay.
Okay.
Ke kgotso ka sekgowa gore go le kgona go tshwara gore re bua ka eng ke genetics kana genomics, mme ha re se dirisa mo kalaheng thata re gane le sekgogo ka sekgowa go bitswang go genetic editing. Dilo tse ke dilo tse e leng gore mo Setswaneng ka ko go rona di diša ga re leba ka ga melaong kana ka ga molemong, mme ha re lebelela mo Setswaneng sa rona ga se dilo tse e leng gore di diša mo go kalo. Something otherwise. Okay, we're going to back one. I'm going to be. Nale na kita ko mutata aba mutin yani ngabe that's why ibuta katao ay pwede katao lang katao
Kita lang kanya para sa photo. Kaya mo at nalimuto kung basta ni kama huwa kana ko lemma ko mo to ona
Kita ko pinili kung sa ka pinili sa rin pinta na nagpapagpili. Kaya kung ka kala hiyaman na lisod po, pinagkakot-halos. Uwit pinakakita na mo po at hapsin, hindi mo kakaroon ng hindi mo nilang mamampo ka na mo sige. Even myself. Karulan ay. Hindi mo sige karulan at mo nilang mamampo sa sarap ng doon. Ini naling tira mo nilang mamampo. Kito na mo tawawan nilang mamampo. Utak kala ko raha, hindi ito lagi puta hari ija. Por ejemplo, neli hata kana nungo kana kaso hamu with energy. Nya hatte ni pisa ko de ratio ya ora ya le tsatsi le tsatsi. Ni mo ten hatso se se mo na iso ko mo ko so.
Sekai se re ka se dirisang sa sekgotso ke gore ra itse gore mo bogologolong e ne re ngwana a sena go tsholwa go bo go twe ha dira jaana o goditse semamang selo se se raya gona gore mo go tlholegeng ga gagwe mo lesikeng la gagwe go na le bangwe ba e leng gore ba ne ba itaya kana ba tshwana le ene jalo selo se ke gone ka e leng gore segotso se tswa mo ngwaneng go ya ko dikokomaneng sa lelapa le lengwe hela.
Segotso go na le gore o ka tshola ngwana ga go ka tshawana ka tsentsi a bua ka mafapha ga se tla go tla le nna ke go ke mo go tla
Thank you
think
very
we
much
can
for
stop.
sharing that.
Okay, yeah.
Thank you. Thanks so
That
much.
is what, yeah, the video really, after if you go continue further, you find that it explains the cell, the nature of the structure of the cell, the chromosomes, everything that is included in the cell, so that communities will really appreciate where this heredity, or what they call it, heredity diseases, they come from. They have to understand that these diseases, they come from a cell, and a cell is the structure of the whole body. So they really appreciated that. And what we continue, we did a lot of animation to explain the structure of the cell, the gene, the chromosomes, DNA as it is, so that they understand. And we also use animation in this video using our local language to explain genome editing, so that they can appreciate when we discuss what it means and how it can be used for medical intervention. Over and above
Thank
the
you
video.
so much, Doctor.
Okay.
Thank you, Doctor, for sharing that with us, for your presentation and sharing the video. And I certainly have one or two questions for you. I'm going to hold them over until we have our panel discussion, and just in order to give our next speakers a chance to also share their excellent work with us. So thank you very much, and we'll come back to you with questions during the panel discussion. And I'm sure our intervener will also have comments. Thank you. So our third speaker is Dr. Kenya Kamga-Karen, a Cameroonian medical doctor whose passion for genetics started more than 10 years ago, when as a medical student, he worked on etiologies of developmental delay in children between 3 and 72 months for his final dissertation. For the following 5 years, he worked as a general practitioner in a semi-urban setting before moving to the prestigious University of Cape Town to complete his PhD in genetic counselling. He is currently a postdoctoral researcher in medicine at the University of Cape Town, and also works as a genetic counsellor at the Limbe Regional Hospital in Cameroon. Dr. Karen will talk about a documentary to communicate genomic research findings to a community with a high burden of Fragile X syndrome, a rare genetic disease. Thank you, and over to you, Dr. Karen.
Thank you, Dr. Gail, for giving me the floor. So my presentation today will be, I'll be talking on Fragile X syndrome documentary that we use that we develop and we use for public engagement, like a public engagement tool. I'll be sharing with you my cultural journey in a small village of Cameroon using the following plan. So I will start by defining Fragile X syndrome as a genetic disorder which is characterized by intellectual disability, behavioral changes, and various physical characteristics. The physical characteristics could be long face, large ears, and large testes. And this condition is caused by a mutation in a gene that they call FMR1 gene, which is responsible for the production of a protein that is very important for brain development, as you can see on the picture beside. So in Cameroon, we investigated a large family in a small village where there is a high prevalence of Fragile X syndrome due to a founder effect. Here is the pedigree of the said family, where we have several people. Those who are colored in dark, there are people who are affected. Those that have a dot and a circle, they are carriers. So in this same community, there are many stories about the cause of Fragile X syndrome, with the main one being a cause model, which says that the chief of the village actually cursed his daughters, that because they did not attend to the funeral service of one of his intellectually disabled servants. Other explanatory models that are in this community, you have the spiritual model, the socioeconomic model, and things like the genetic model. And the genetic model is just an emerging explanatory model due to the genetic diagnosis that we offered in this community. In order to engage with this community, we stayed in the community for over 2 years, where through observations, interviews, and focus group discussions, we interacted with the community. And we closely collaborated with community leaders to ensure that their voices were heard and were represented in during the collation of our documentary. These community leaders were mainly affected families, the chief and the elders of the village, religious leaders, and other non-affected community members. This was not an easy task because we needed to build trust in this community. Why? Because trust, first of all, serves as a foundation for effective communication and collaboration and engagement. I can remember my first experience with the community where several elders in the village talk about mistrust, that they could not trust researchers. They could not trust researchers anymore because of the past experiences that they had with researchers, where researchers came into the village, did studies, but they never came back in order to fit the findings or give them the results of those findings. Also, my positionality like a physician in the village, people thought I was somebody who had authority on them and was supposed to impose things on them. And also being a foreigner to them, it was very difficult to create a good communication channel between them and our research team. So it was very important to establish to establish trust, to overcome cultural barriers, dispel misconceptions, and build rapport with community members. So building trust within this community was a deliberate and ongoing process throughout our research, where we took time in order to learn the cultural norms and values and tradition of the community. This was done by going maybe to funerals with them, being in the village all the time. Any ceremony that they have, they usually see us around, and they took us like part one of them, so they could easily open up and disclose a few things, disclose many things to us. Another thing is that we demonstrated humility and the willingness to listen to the community in order to learn from them. Being a physician, people thought I was there to give them knowledge, but actually I made them understand that I'm there to learn also from them. Given that in the community, actually there is an interaction between modern medicine and traditional medicine. So people thought I was there in order to drive them away from their normal practices that they usually do. So after understanding that I'm there just to learn about what is happening in their community, they started collaborating with me. We also conducted community engagement activities where we actively sought input from every community members in order to make them be more engaged in with their research. One of the challenges that we had during our engagement was the presence of cultural stigma and the misconceptions surrounding genetic conditions like Fragile X syndrome. So in some instances, there was reluctance within community members to openly discuss and acknowledge the condition due to fear of social ostracism or discriminations. And this posed a barrier in raising awareness and engaging individuals and families that were affected by Fragile X syndrome. Following the completion of our study in the village, we developed a short 10-minute documentary in order to feed back our findings to the community through community engagement activities. This documentary reported on what people understood Fragile X syndrome was, the pattern of inheritance of Fragile X syndrome and stigma associated with Fragile X syndrome, and the preference for returning information about this syndrome. The documentary was then evaluated through a survey that we are going to share the findings with you people. So the survey, actually, we surveyed 42 individuals and most of them identified English as their primary language. The survey revealed that more than 75% of participants watched the documentary entirely. Also, participants gave us qualitative feedback from the documentary, and there it highlighted 3 themes. The first theme was that the documentary had the ability to enhance genetic knowledge, where we have this quote, a community member saying, the explanation of what is going on in the village and understanding that there is no curse, but a medical condition was a fascinating point to highlight. This is what a participant in the village said. Another important thing to highlight is the importance of community involvement in the documentary. They said, I enjoyed the whole story, especially the fact that the community was involved, the visuals, and the simple language used in explaining. The last interesting thing was that this documentary could be used as an effective tool for community engagement. Another participant said, the film will contribute towards demystifying genetic diseases and bring awareness to the benefit of seeking help from the medical establishment. Nevertheless, there were some areas where people were not very happy about the documentary. The first thing was because of the language, which was in French and in English, where it was also subtitled in English. So some people said they would have loved a version of the documentary either completely in French or in their local language, which was Ngombale. Also, there were some background noises that were finally edited. Moreover, the documentary, despite these lapses, the documentary received a 4.5 rating from the community members, and all participants were willing to share the documentary with their friends, families, and colleagues. Also, most participants said the documentary can be used for genetic counseling, lectures, and engagement, where a community member said it's a practical way to educate about the importance of genetics in healthcare. To conclude, I would say that from the Fragile X syndrome research and the documentary, we learned that building trust between the community and researchers is crucial for the success of a research project, and demystifying cultural and demonstrating cultural humility, respect, and transparency throughout community interaction is key to earn trust in the community. And we therefore suggest that this documentary is an appropriate tool for public engagement with regards to genetic condition in our context. I would like to acknowledge all those who participated in the creation of the project and the documentary, and also the funders of the documentary. The QR code is there for those who want to watch the documentary. They can scan the code. Thank you for listening.
Thank you very much, Dr. Karen, for a really interesting talk and presentation. I think we have enough time for one question at the moment. I'm not seeing any open questions in the Q&A box, which is what we're using at the moment. But we'll definitely open up to verbal questions a bit later on when we get onto the panel discussion. So I would like to just understand from you, Dr. Karen, so you mentioned the very high score, the very high rating that the video received, 4.5 out of 5. And the ability to enhance genetic knowledge was acknowledged. The importance of community involvement was acknowledged, and the effectiveness of the video as a counselling tool as well. So you were very you really emphasized the concept of trust and trust building, and showed how your approach had so many intentions for trust building. Did you get any feedback on that particular issue of whether the community members that you engaged through this process actually felt more trusting of science and research after this initiative?
Okay, actually the survey that we conducted did not prompt that question specifically, but from our interaction with the different community members who watched the documentary, we found out that they actually trusted us more because we brought in something to them which other researchers never did. And they knew that, okay, as they are coming into the community, we can learn more from this group than other groups. And to testify that to nearly every year since we started engaging with the community, they usually like to invite us during their family reunion that usually occur in October every year. So they usually like that we should come and talk to other family members about the documentary, about Fragile X syndrome, so that they should be aware of what is happening in their community. I think this is a sign that the process of building trust was somehow good in a sense.
Good to hear. Thanks very much. We'll now move on to our next speaker. And our next speaker is, in fact, our last speaker. And we have Dr. Olivia Matsabane, a neuroethics researcher and faculty member in the Department of Psychiatry at Stellenbosch University in South Africa. And her work focuses on the ethical, legal, social, and cultural implications of neuropsychiatric genomics. For her PhD, Dr. Matsabani explored issues of stigma and feedback of individual genetic research results in neuropsychiatric genomics on the African continent. Through the African Postdoctoral Training Initiative, she completed a 2-year postdoctoral fellowship at the NIH in the USA on familial coping with receiving a genetic result related to a neuropsychiatric disorder. Dr. Matsabani is a member of the Leadership Committee and Africa Ethics Committee of the Psychiatric Genomics Consortium and a member of the International Brain Initiative's Cross-Cultural Neuroscience Working Group. She was the secretary and then the chair of the Fellows Committee of the Human Heredity and Health in Africa Consortium. Dr. Matsabani is also the immediate past chair of the International Neuroethics Society's Student Postdoc Committee and current representative of the International Neuroethics Society to the International Brain Research Organization. And Dr. Matsabani will discuss the use of deliberative processes for community engagement in genomics research in Africa. Thank you, and over to you, Dr. Matsabani.
Thank you very much, Dr. Joe Black. I would, sorry, Prof. I would like to share my slides, which I believe I must have been sharing a moment ago. Are they sharing right now?
Yes, we can see your slides, your first slide.
Okay, perfect. Thank you so much for confirming. So thank you so much for this kind invitation to share some of the work that we've done in the project that I've been involved in here in South Africa, and which was also in collaboration with colleagues in Botswana and Kenya as well. So I am going to speak today on the title of using deliberative focus group discussions in the context of 2 neuropsychiatric genomics projects specifically. And I'll speak about the deliberative engagement approach that we used in these projects. This particular approach is quite novel in health research, and it stems from deliberative democracy, where in the context of governmental processes, it's been used as a form of an inclusive approach to develop policies that are relevant for specific communities. So it brings together a collective of people from diverse perspectives, and first of all, wanting to start by educating or providing information regarding the topic that's going to be discussed. And then second of all, it aims to foster deliberation on the particular health topic. So on the project that I will speak about today, in just a moment in the next slide, the topic of discussion was around understanding genomics, understanding how genomics can inform health and impact on health rather, and also, what is genomics research and the need and also the processes that are followed in the genomic studies that our participants stemmed from. So the advantages of this particular process that we used was that it aims to provide a balanced, informative approach, and it's also an opportunity to hear diverse and even sometimes conflicting views, and even the views of individuals within the process can actually change throughout the process. So it allows for that particular opportunity. It's also hoped that the process can be reciprocal and transformative, so not just for just being informative for the scientists, but actually being a reciprocal process where participants genuinely learn, they feel that the process has been and impacted them in some kind of way. And its aim is really to be bi-directional and multi-directional. So the project that I was happy to be involved in to do a postdoctoral fellowship was called the FGenera project, Individual Findings in Genomics Research in Africa. And this particular project was led by Professor Jantina de Vries and Professor Ambrose Wonkam, who I'm sure many of you may will know because they are excellent scientists in the context of bioethics and genomics on the continent. And this particular project was an ALSI collaborative center within H3 Africa. It focused on returning individual genetic research results to participants, and we used deliberative focus group discussions to really explore what are participants' preferences and expectations of feeding back individual genetic results in genomics research. So the reason why the project decided to embark on this project really was because this was a real challenge in H3 Africa research studies, and there was at the time not much evidence or policies to guide the African continent on this particular issue. And so the project that I was involved in and the work that I was involved in was conducted in collaboration with two other neuropsychiatric genomic studies, one which was NeuroDev in South Africa that enrolled parents of children who had neurodevelopmental conditions. So these were children mostly who were on the autism spectrum. And then there's the NeuroGap study in South Africa, which enrolled adults who have a diagnosis of either schizophrenia or bipolar disorder. And as mentioned, I do have a colleague who was working on another arm of the project in Botswana within the CAFGEN project under H3 Africa, but I won't be speaking about that, but I'd be happy to share the publications relevant to that process at the end of this presentation. So the deliberative focus group discussions that we embarked on was really novel in the sense that we had done traditional focus groups before, but had found that the information and the data that would emerge from the discussions was quite limited in that a number of people had not actually thought about or been in a space where they could receive any kind of information about what genomics is and how it impacts on health, and then also have an opportunity to reflect on that information and come back and ask questions or inform on some of the responses that they may have initially provided during the research process. So how the process then worked was that we had 2 weeks of engagement with participants. The first week, we had a consenting and information session, which lasted about 1 hour and 45 minutes. In reality, this lasted a little bit longer in the sense that people really were excited about engaging on the topic of genomics and science. And it sometimes, we'd go into the short break, and as people were eating or having their snacks, we would be still discussing this particular topic. And, I'll speak a little bit more about the tools we use to do that. And then we had a deliberative focus group after the break, which lasted about 1 hour, where we, after the educational component, participants were then able to start sharing what they thought their opinions were on the various ethical issues. Some of the ethical issues would relate to, how would they respond to findings that were identified in a study that were unrelated to what the study had intended to find or to look for, investigate. And then others related to the idea, the fact that research is not diagnostic, and how would they feel about receiving genetic results, individually related genetic results, with that understanding, concerns around privacy, confidentiality, clinically actionable results versus results that were not clinically actionable. And participants really started to grapple with some of these concepts, even concepts around autonomy and how researchers could demonstrate a respect for their particular, for their autonomy in the context of genomics research. And after we've had these discussions with participants, they would go home and reflect take the information that they've learned, engaged with family members and members in their community, and came back a week later to have another discussion, which again is demonstrated as an hour, but would sometimes go into 2 hours because it was just so enlightening and so stimulating for participants to have these particular discussions and to have a space to have these discussions. And I will say that the discussions were held in participants' home language, which in the South African context, we enrolled participants who come from the Amaxhosa cultural group, which is the language that I speak, and I could speak to them in isiXhosa during the discussions. And within the other group that we enrolled in this research was identified as the mixed ancestry group, and they largely spoke Afrikaans, which is a language in South Africa, one of the 11 languages, and the co-facilitator of the group was Afrikaans speaking and would then be able to lead in that event. So this was really an opportunity for people to express themselves freely and not to be constrained by any language barriers during the research process. So the research tools that we used were a manual, a deliberative focus group discussion manual that was developed by Dr. Elsie Breed in collaboration with guidance from Professor Vicky Marsh in Kenya. And this particular document, it is available online. I'm happy to share a link after this discussion where individuals can access it and modify it and have a look at it and see whether it might fit for any projects that they are interested in. But through the process of educating participants, we also developed a short video which allowed them to get an understanding of what are genes, how they impact on health, and also genomics research more broadly. And then we also developed brochures that were shared with participants, and they could also take those home and share it with their family members and community members. So in the study, we had 4 groups which were enrolled from the NeuroDev project, which was the parents of children with neurodevelopmental conditions, and 2 groups which were from the NeuroGap study, where we had adults with a diagnosis of bipolar disorder or schizophrenia. We've got a paper that I'll share at the end, and that's based on the NeuroDev participants specifically. And just to give you a sense of some of the demographics, their mean age was around 40 years old from both cultural groups, and also about 40% of them had low-paying jobs. 40 or 30% were unemployed. So this was a range of participants who didn't have a lot of resources and access to be able to engage and to understand genetics and genomics and how that could impact on their children's diagnosis of a neurodevelopmental disorder. That they were also had mostly around 70% to 80%, I'd say, secondary schooling and education. So this particular process of deliberative focus groups provided more informed opinions. We identified, based on having experience of doing this research with traditional focus groups in this particular context. It also allowed for an opportunity for people to change opinions, for people to have differing opinions. The aim was not to get a clear consensus and to not consider opinions that did not, did not speak to the same topics or the same findings in the particular process. And so we really did have differing views, and people coming back the next week saying they've changed their perspectives, and they don't want to receive their individual genetic results if there were to be a finding that would be relevant, and some coming back saying they do. So it was quite an informative debate during the sessions, and that participants felt empowered them because they were felt listened to, and they had an opportunity to express themselves in ways that they may not have had before. And then it also provided better quality data in the sense that it was richer, and we were able to really get more information as to what informed participants' views, rather than just having one-line responses and not really understanding why they said what they said. In terms of building trust, I just wanted to share two quotes really quickly as to what participants said, even though they were aware that the projects that they had enrolled in, like Neurative, for instance, had indicated that they were not going to, in fact, feedback individual related results. They still felt like it would be a sign of building trust and a sign of respect for the community and the individuals if the scientists took it upon themselves to actually aim to feedback the results. So this one, for example, says the Neurative researchers did explain to us there's a part, like the lady said, it's not like a must for them to let us know, but I think they should use their own initiative at that time. If they find something else, and just, not act like a doctor or researcher, but act like a person and just tell that person. And the second one says, as researchers, you have to keep such a person in the loop, because you'll never know at the end if they will blame you or not. You might say that you knew about their condition and did nothing. The blame will be on you as researchers. Let the person be the one that has the responsibility to take action. So these are just some of the examples of participants really indicating that they would prefer to receive results from the study if anything was found, most of them, even though there were some views that were against that. So I will go very quickly over this, but essentially we looked at whether people wanted to receive results regardless of severity and actionability and preventability, and most of them said yes. The results were viewed as valuable because they could empower and emancipate them and their families and communities with knowledge that could be helpful. The risk information was believed to, if there was information to disclose, was believed that it could motivate healthier lifestyle choices. And also some were uncertain whether they wanted to receive results or not because of fears of anxiety, psychological distress, and but overall, a demonstration of respect from researchers was articulated as an act that would build trust amongst the participants. So this is the publication that is out at the moment, and I just want to acknowledge the research team, Professor De Vries and Professor Wonkam, and everybody who participated. Thank you very much. If there's any questions, I will be happy to take them.
Thank you very much for that presentation, Dr. Matsvani. I am now going to hand over in the interest of time. We have just over 15 minutes remaining. So I'm going to hand over to our intervener, Dr. Andrew Nandogma, who heads the Communications and Public Engagement Unit at the West African Centre for Cell Biology of Infectious Pathogens at the University of Ghana. He has over a decade's cumulative work experience spanning the education and international development sectors, first as an educationist and later as a development communication professional. Andrew, can I please hand over to you to give a brief commentary on the collective presentations? Thank you.
Well, thank you, Dr. Jill. And thank you to all the presenters, for your very insightful presentations. I would like to begin my intervention by dwelling on the works of the docudrama that Chewa spoke about, and then I will also talk about another project. But then before then, my focus is going to be on the role that public engagement, or if you like, community and public engagement plays in terms of engaging with science, or to be more specific, genomics. So this has often been seen as a more intentional way of bringing publics together and then the scientists for mutual learning and shared decision making. And this is often premised on the assumption that both the publics and the scientists have expertise, valuable expertise, and valuable perspectives and knowledge, as well as competencies to contribute to the development of science and its application in society. And most often than not, these make the case for community and public engagement. And I believe that over the course of the various presentations, these points I'm about to mention or point us to cut across each of the presentations that have been given to us. So community and public engagement interventions, one, helps to build trust in science, and then also scientists as well as their publics. It also helps to secure ethical compliance, right? It also helps to improve the research design, right? As well as the fact that it optimizes research outcomes, especially when it facilitates participants' recruitment and retention in research or other clinical trials. So the idea is that if you do not engage in this from the onset, that is where you find you do not engage the publics from the onset. That is why you find out that people are losing interest in terms of being part of the work. And at the end of the day, the ultimate goal of coming out with a co-created product, and also for people to have to take the results of the research will not happen. Again, it reduces the belief of there's always, I think in Karen's presentation, for instance, he drew our attention to the fact that there were instances where the community members had doubts. So when most often than not this happens, it helps to reduce the belief of the one party, especially the scientists, the perception that, or the misconception that the scientists are trying to mislead them through some sort of false claims, especially when it comes to genomic studies where sometimes samples have to be taken. And I will come to the specific example of the public engagement for strengthening genetics research, which led to the development of the docudrama on the genetics of hearing impairment in Ghana. Most often than not, you find out that people were adamant or people were reluctant when it came to offering, their samples, like blood samples and other samples for genetic or for research laboratory tests to be able to advance studies in the areas of genetics. And so when these aspects are not handled carefully, the ultimate objective will not be attained. Again, it accelerates the uptake of research findings and policies because from the outset, these people have been carefully identified and everybody has been brought on board, and everybody's contribution is kind of recognized. So some of the key tenets of public engagement with science, especially in the area of genomics, is the fact that it's not kind of bottom-down approach. It must be bi-directional, or if you like, what we in communication will say is a dialogic interaction between scientists and non-scientist publics. And then it seeks perspectives from non-scientist publics as well. And it involves listening. Either parties have to listen to what the other has, and then using community perspectives to enrich, science. It also promotes inclusion and then demographic diversity as well as transparency. Then we cannot leave out the fact of mutual learning and then benefit. So then I come back to the last presenter's point about using deliberative focus groups. And I want to state that this approach was adopted in the early stages of the development of the docudrama on the genetics of hearing impairment. And let me also emphasize that first of all, when you get this strategy well planned, you see that future engagements, future research engagement with the communities will even be easier, because with the example of the docudrama, this was kind of a follow-up, or for the lack of a better expression, on an earlier project where WAGBIB's PhD students went into the communities, in fact, targeted communities with high cases of deafness, to actually engage the community members on the genetics of hearing impairment. And then they used approaches like these deliberative focus groups, as well as these town hall meetings, community engagements, to get the buy-ins of these people. Now, given the complex nature of genetic research, and the fact that people will normally be eager to get feedback, there was the need to think of ways of continuing to sustain their interest in the process, in the research. Okay, so that it's not about going to them and then getting them to give samples and then you go and nobody hears anything again. I know, like I said, it's a dialogic thing. Once in a while, you get back into the communities. And so on this particular project, what happened was that eventually the docudrama on the genetics of hearing impairment came out, and after the engagement with the various communities, well, we thought, first of all, they got to understand, because the whole documentary was put up with their involvement. They accepted it, and then they kind of, had wished they knew some of the things that they saw in the documentary earlier. Beyond that, there were instances where we had other projects that, again, we had to go back to those communities. Other projects like even PUBGEM. PUBGEM is a project which targets two disease areas, two genetic disease areas, one being hearing impairment, the other being sickle cell. Again, with the hearing impairment component of the study, we had to go back to these communities. Now, here lies the case that we have had previous instances where we've gone to them, and consistently we go back to them, but each time we go back to them, we have something to show them that through this partnership, these are the products we are sharing with you. So first of all, through the earlier partnership, we came out with a docudrama. Then through subsequent engagements, we were able to develop what we call a hearing impairment resource pack for Ghana. Nothing like this had existed before. So in a nutshell, the point I want to make is that if we are able to manage, and there are three things I want to highlight here. So if I'm able to manage the community entry aspect well, if I'm able to manage the community engagement component well, and if you are able to do what we call community management itself, in terms of periodically going back to them and then giving them feedback, especially in terms of products, then, like, they are going to be a part of the process each time you call on them, and they are going to always be interested in knowing the extent to which, say, certain progress have been made as far as their conditions, or not even their conditions, but as far as what they need to know about genetics and genomic research is concerned. Yeah, so this is my very brief intervention for this period.
Thank you very much, Andrew, for your insights and your thoughtful commentary. We just have a few minutes left. So at this point, I'd like to open the floor. We probably only have time for one question, maybe two, from our attendees. If you would like to ask a question to our panelists, please raise your hand and we will entertain your question. If not, then I have one more question which I would like to ask the panel. Do we have any burning questions for our expert speakers from the audience? Any hands raised? See any? Okay, then I'm going to open this question to all four speakers. Thank you again very much for your presentations. There was a lot in there, very rich, and really a diverse learning to be gained from all of this amazing work that you're doing. So my question is, what do you consider to be the most important element of your work in regards of learning something new about building trust in engagement on research on the topic of genetics and genomics in health? What was it? Was there something new that you learned? Was there something through the projects that you have presented to us today? Can you tell us about something that you took away from that research that you didn't know before, that you thought was a really aha moment for you, where you really learned something new that you would like to tell other people about? It's open to all of our speakers. In any order.
I suppose maybe I can go, if that's okay with the panelists. So from our project, I think one of the key things, because we were involving parents of children with neurodevelopmental conditions, one of the key things that we quickly learned was that we needed to think about childcare. Whilst involving the parents in the research, which was taking quite an extensive amount of time, we also needed to think creatively about, well, how do we engage perhaps? So what we did, for instance, is we engaged with a local NGO that is skilled and has psychologists and occupational therapists, and they could actually create a space where they could play with children whilst we were doing the deliberative focus group discussion. So parents didn't have to worry about what they would need to do or choose opt to not participate in the research because they didn't have somebody to look after their child with special needs. And I think that's not something one may necessarily think about when designing a study, but it was something very, very crucial in order to make sure that the study was a success. So I've noticed there are some efforts and initiatives that are starting to look into funding for childcare in the context of research for different reasons, but that was something that stood out for me, to create also gender diversity in the work that we do. Thanks.
Okay, thank you. And we do have one question from Elvis to all speakers. What will be your take home on how to better involve participants? So, and with specific examples. So building on then to what Olivia has just been saying about providing care for children while parents are in deliberative focus groups. What would lessons on how to best involve participants in your work? Do we have any more responses?
Can I speak? Because I think when I spoke, my time was really cut short because maybe I presented my I think there are many things that we can like, collectively from these projects, the wonderful projects that were presented today, because all of them involved communities, and they involved people with different educational levels, people with different cultural beliefs, people with different cultural norms. So what I would suggest that maybe moving forward, first of all, as researchers in this area that is new to us, and researchers that are working on issues that talk about genomics. First of all, my thinking is that for us to build trustful community engagements is to understand, to promote, to respect the values. If we can, first of all, try to understand what is it that they value when we want to talk about issues of genomics. First of all, what is it that they respect? They want us to respect. What are the norms? Because this, when you're talking genomics, you're talking of a life of a human being, complex as it is. What are the things that they want to know? What are the things they want us to know as researchers that will promote and understand, more especially their values? If you can do that, then I think it will be easier even for us to navigate. So a lot of research is needed, first of all, to go to the field. Like right now here, I'm not even a health person, but I'm just doing this for researchers, for health people, practitioners, so that when they go out and engage, it's already that people are already sensitized. They know, while we're talking about the genomics, these are some of the values that you should be careful and to how to go about them. Because people, if we engage with them, they will tell us what to expect. I think that will promote long-lasting, trustful engagement activities in genomic research. That is my input.
Thank you very much, Kaiwa. Values, respect, and norms. What are the things that they want us to know as researchers? And I think that's a really brilliant and thoughtful point for us to end our webinar on today. I just would like to end up by saying, on behalf of the PUBGEM-Africa initiative, express our sincere gratitude to our panelists, our intervener, and all our attendees today. We hope that in the spirit of Harambee, you will join other PUBGEM-Africa Science and Society cafes, be they in person or online. So the next cafe will be on genetic dialogues, ethical, socio-cultural, and public engagement perspectives for rare diseases, diagnosis, and research in Africa. It will take place on the 13th of May, so please put a holder on your calendars for that date. Look out for social media channels on PUBGEM-Africa, and we really look forward to seeing you at our next event. Until then, we wish you all the very best of health, and thank you very much for attending. And so until the next time, I bid you goodbye. Thank you.
Okay.
Thank you very much.
Thank you.